From the Soapbox is the official podcast for the American Animal Hospital Association's digital newsroom, Trends. Here, we take inspiration from the familiar soap notes, but instead of looking at the condition of a patient, we're diagnosing and discussing the state of the veterinary industry. We'll chat about the challenges, trends, and innovations shaping the veterinary world with voices from across the community. I'm your host, Dr. Emily Singler. Thanks for listening. Hey everyone, welcome to another episode of From the Soapbox. My guest today is Dr. Renee Rucinsky, a board-certified feline practitioner and co-chair of the newly revised AAHA Diabetes Management for Cats guidelines coming out on April 30th, and AAHA Diabetes Management for Dogs guidelines coming out in the fall of 2026. Because of her love of all things feline, and quite frankly because there's so much to discuss, we stuck to diabetes management in cats in this episode. So, of course, we covered the SGLT2 inhibitor drugs and how they've changed the way diabetes is treated for many cats, making it a boring disease, according to Dr. Rucinsky. So, as part of this, we also included the importance of careful case selection and monitoring, and we still covered insulin, what's new, and how cost figures into the equation. And she gave us a sneak peek at a brand new collaboration between ABVP and AAHA, so make sure you listen to the end to get all the details. And now, without further ado, getting her time to talk from the soapbox, Dr. Renee Rucinsky. Hey, Dr. Renee Rucinsky, welcome. Thank you so much for being here with me on the podcast.
Thank you for having me, and I'm excited to be here and talk about my favorite topic.
Yes. And I think it was a few years ago when I first interacted with you for an article on the topic, on the feline diabetes. And certainly I was saying to you just a few minutes ago that like your name has come up in many different circles related to the topic over the years. So I'm excited to meet you and talk with you and learn more about feline diabetes. And I know you were one of the co-chairs of the new AAHA diabetes management guidelines. But before we kind of like jump into that, I would love to learn just a little bit more about you, sort of like your vet med story, like kind of where you began in vet med and how you got to where you are now. Anything that you would like to share with our audience on that topic?
Yeah. So, I'm a graduate of the University of Missouri, and have been a board certified feline specialist for a lot of years now at this point, by the ABVP. And I think that my journey as far as what I do now a lot with with diabetes and with hyperthyroidism just comes from being a cat vet for so long. You know, you don't have much choice but to try to be good at these things. And um, so that's been kind of my journey. And I'm currently a solo practitioner at a feline specialty hospital in Maryland. If anybody out there needs a job, please reach out to me. I'm hiring. Anyway, that's neither here nor there. But I think that I've always been a rather competitive person, and I mean that in a good way. I've always been an athlete and feel like that kind of competition lifts everybody up and makes everybody better. And trying to be the best doctor I can be has allowed me to work with AHA for all these years. This is the third diabetes guidelines that I've been a part of. And one of my favorite things about it is working with other specialists and being able to share our ideas. And frequently, I'm the only general practitioner specialist. And it's interesting to work with the academics and all of that. But yeah, so I see regular day-to-day cat practice kind of things, wellness and all that. And then also do a lot of referral medicine for more complicated cases.
Yeah. And did you always know that it was going to be like cat specific? Like where did your love for feline medicine begin?
Yeah, that's a good question. No, I've always loved cats. I think cats are really hard, and that goes back to the whole, being competitive kind of thing. But um no, when I planned on going to vet school, I had always thought that I would go into internship and surgical residency. I really like surgery. Um, but it was when I think I was a second year vet student that um, uh, a feline practitioner from Kansas City had come to talk to, I think it was our AAFP student chapter. Her name is Eliza Sundahl, and she was one of the early feline specialists. And when I met her and heard her talk about the way that she can practice as a specialist, but still be the family doctor, it was really, really intriguing to me because I like that relationship that you have with a patient and the owner from kittenhood to geriatrics. And as a surgeon, I felt like I might not have that same relationship long term, and really thought that going into species specialty would be a better fit with how I want to practice with my patients and my clients.
Yeah, I've loved hearing just with the guests that I've had on the podcast. So many of them who are doing like you, they're so renowned in the field that they're in. They're doing such amazing, incredible work, and hearing how many of them started out thinking they were going to do something very different. Um,
Yeah,
and
yeah.
just it just goes to show, like you never know where your career is going to be, and um, where you're going to find your passion and your success and all of these things, and it may not be exactly where you think it's going to be, and that's
I remember being in vet school and sitting next to one of my very best friends for, all that time. And he loved endocrinology, and thought it was just amazing. And I'm like, this is awful. I hate this so much. And now, now I'm like, oh my God, I don't know if I don't know how this happened. Now I can't imagine, having any other favorite thing. But in vet school, if you had told me that this is where I would be, yeah, that I wouldn't have believed it.
yeah, it's not the first time I've heard that too. I've heard people say like,
Yeah,
I
I'm sure.
hate behavior, and now it's like it's one of the main things I do, or like I hated this.
Yeah,
Oh,
yeah,
it's like my bread
exactly.
and butter.
Mm-hmm.
Well,
For sure.
goes to show you never know
Yeah.
where your
Yeah. Don't
career is
plan
going
your
to lead
life,
you.
right?
Exactly.
Yeah.
Um, well, and I know I'm so grateful to have you on the diabetes guidelines. And I think this is the first time we've done something unique in terms of splitting the guidelines into two separate guidelines. So now we have or soon coming out, we'll have the AHA diabetes management guidelines for dogs, and then a separate one for cats. Um, so
Yeah.
we decided we were going to kind of focus on the feline guidelines today, since that is your area of passion and expertise. And
Right.
just kind of in general, like what was the discussion like in terms of I know the guidelines get updated, particularly on important topics like this from time to time. It's important to update them. But what do you think were like the main reasons that because there are always a lot of different guidelines that we could look at updating, like why what felt pressing about diabetes in terms of updating it now? Like I'm sure there are probably lots of reasons we could come up with in terms of why it was important to update the guidelines and sort of the body of knowledge that we want to put out into the world in terms of management of diabetes now compared to what the last update
Yeah.
contained.
Well, I think the shortest answer to that really applies to the cat side of
Yeah.
things, and it's been with the introduction of the use of the SGLT2 inhibitors to manage diabetes in cats, and that was something that we really needed to touch on in a big way, since they have been available for a few years now, a couple years, and there's still a lot of confusion about when to use them, how to use them. Um, a little bit on how to think a little bit outside the box on how to use them. And so it was time for that. And as far as splitting the guidelines, I mean, now, I mean, they always should have had cats listed first, I mean, that's just a no-brainer, right? But now with the new treatment options, the volume of information was just way too much to put in one document. The stuff for dogs has not changed that much. We don't use SGLT2 inhibitors in dogs, and so it just seemed logical. The diseases are, have the same name for dogs and cats, but it's really different. I mean, it's a very, very different disease process and treatment ideas and things for dogs than it is in cats.
Yeah, I agree. And I remember looking at a draft of the guidelines before the final decision was made to split into canine
Mhm.
and feline, and it needs to be extremely comprehensive and extensive, and um I think splitting it will help make it more digestible, accessible, user friendly, because all that information, I remember we had a discussion, is there anything we could take out? And my opinion certainly wasn't the only one. And I was like, but I remember saying, I don't think you should take any of this out. This is
Yeah.
all really important. We need this all to be here. Such an important reference.
For sure. And I think that's the key word. It's a reference, right? So, prior guidelines have lumped everything into sections together, diagnosis of dogs and cats, treatment, dogs, cats, problems, troubleshooting, dogs, cats. So to find something in that giant document, like you just want to talk about, cats that are on insulin that are having trouble regulated, what do I do? And you have to go through all the stuff for dogs and cats and troubleshooting and all that. So
Right.
having it separated into just feline, just canine automatically makes it easier that way. And then, just going down from there. So I think it's going to be much more approachable, um, way easier to find what you need and use it as a reference tool.
Yeah. And then another part that I'm working on is we will eventually have 2 separate dog and cat toolkits to support the guidelines as well. So
Yeah.
some very actionable, practical resources to help support the use of the guidelines. So excited about that too. And I
Yeah.
did have SGLT2s on kind of the top of my list of things to ask you about. I believe that was the first. That was the topic of the article that I first reached out to you about years ago, and it was when the first drug, Bexacat, was just coming on the market. And I correct me if I'm wrong, but I believe when we spoke, you hadn't used it yet. But you had done some research into it, and so we were speaking sort of about what was known and what wasn't known, and what you thought were probably going to be the biggest concerns. And now, as you said, it's been a few years. There are 2 drugs in this class on the market. So I just wanted to kind of check in with you and see, like how do you feel like it's going with these drugs, and like how have they changed diabetes management for cats?
My gosh, I feel like we should have looked back at that old article before we did this, because I'm sure
You
that
can
whatever I said is completely ridiculous
Oh,
now.
I don't
But
think so.
um,
I think it was
no,
very helpful. It was very helpful. I remember just pointing out, like, these are all the things, and that I think are still very accurate. Like, these are all the things we really need to look at. It was a lot about, like, case selection, patient selection,
gotcha. Yeah.
so that we
Well,
know.
and that's
Yeah,
that's still the big thing with
yeah,
this is case selection. But I think that what's different now, when it first came out, it's new and scary and whatever, because it's because it's new and it's a whole different way of managing these guys. It's not oral insulin, and that's what we have to remember is it is absolutely not oral insulin. It is a tool to help insulin be more effective,
Right.
have an easier time to work in the body, right? So um, I think the biggest change from then to now is that back then we were like, well, diabetic cats, we're going to lean towards what we know. We're going to lean towards insulin. And sometimes we're going to think about using Bexacat or Sinvelgo, right? Now, at least in my world, if I have a newly diagnosed diabetic cat, my first choice is an SGLT2 inhibitor until proven otherwise.
Okay.
So I am always going to um, choose that first unless there's a reason not to. So um, I had two cats this week that came in that were no, three. I had a new one yesterday that are middle-aged fat cats that are drinking more and peeing more and fitting everything,
Yeah.
right? One of them was a second opinion because the primary vet said, okay, you need to start insulin, you need to do this, that, and the other. And the owner was terrified of hypoglycemia.
Mm-hmm.
And I'm like, yeah, we don't, this is a poster child for this drug. So, I think that we need to change the thinking on that insulin doesn't necessarily need to be the first thing we think of, because insulin, when you get right down to it, is pretty scary. It's a pretty dangerous drug. Um, and when you choose an appropriate cat for an SGLT2 inhibitor, it's so safe. It, it's just so safe. And so I think that that's one of the biggest changes in the last couple years as we get more and more used to this drug, that it really needs to be considered the first option and not just the extra option.
That's really helpful to hear. And I'm curious if you get a lot of feedback from, it sounds like, at least with that one case, the second opinion, that veterinarian wasn't comfortable recommending an SGLT2 drug for that cat. Do you know, like, are more veterinarians reaching for it? Are they getting more comfortable with the idea, or is there still a lot of fear about maybe choosing the wrong case for it? And I guess likewise, like, our clients um excited about this and preferring it and wanting it over insulin? What kind of feedback are you hearing?
Yeah, I think there are definitely more people that are using SGLT2 inhibitor drugs, but um I think a lot of people are still scared of it. When I'm out speaking to vets and ask, the audience, how many people are using this and are comfortable with it, the number of hands in the air is definitely going up, but it's still not enough. It's not enough at all. And I think people are very concerned about choosing the wrong patient. And that's valid. It's entirely valid, um but it's easier to choose the right patient now. I think clients are very excited about it, but still scared in some ways. But when you are having that conversation with a cat owner that their cat is diabetic now and they immediately think of insulin and they're like, oh my gosh, okay, I don't know how I'm going to do
Yeah,
this.
right.
I don't know how I'm going to do insulin twice a day. I don't know how I'm going to monitor that they're eating and that all of this is, there's so many things that need to be perfect for the use of insulin too,
Right,
right?
right.
And then when you tell them that we have a safe option that's a once a day oral medication that doesn't even have to be administered orally, that it can be administered with the food, you can just see their shoulders relax and they're like, oh, yeah, okay. I can do this. Um, it's, it, I think that people are receiving it probably better than the veterinarians
That's sort
are.
of the impression I was getting too from what you were saying. Like the clients
You're,
are like, all
I'm
right,
t-
this sounds good to me. Let's get on board.
yeah, and like with anything else, until they get on the internet and see horror stories or
Yeah.
whatever,
Yeah.
but I think that's all reasonable. All the concerns are reasonable.
Mhm.
We just have to be able to explain what we're looking for and why this is a good choice for, a good candidate for the drug, and how we're going to monitor and how we're going to make sure that there are no uh, ill effects, from the medication. So it's all like everything else. It's all about client education and veterinary education and all that. But these drugs can potentially make diabetic management incredibly boring, which is great,
That would be a wonderful thing to have be boring. I would love
right?
that. I
Yeah,
would love that.
yeah.
And from your personal experiences with it, I mean, how accepted are these medications by cats? Are they, I don't even know, are they flavored? Are they just easy to hide in things? Are they, how,
Yeah.
what's working well
So
for you?
The Bexacat is the tablet
Hmm.
form, and that is a beef flavored tablet that is intended to be crumbled and put on top of a bite of food.
Okay.
Some cats will take it like a treat. I mean, they are diabetic cats. They tend to like to eat, right? So you can give it directly. You can crumble it with food. Um, and it's the acceptance rate is huge.
Okay.
Of course, there's always cats that are like, no, I'm not doing this, and people have to figure out a way to do it, but most cats take it very well. The Sinvelgo is the liquid, and it is also a palatable flavored suspension that is meant to be put on top of a bite of food and is incredibly well received. But if the cats don't want to take it on the food, it can be administered directly as well. And really, it goes incredibly well, much better than other medications.
That's good to hear. Um, and then I guess the other part that I'm curious about with this is, are you seeing practices purchase the I think the hydroxybutyrate meters for monitoring? Has there been good uptake on that part of the
I think for the
recommended
most
use?
part, for the people who are conscientious about
Yeah.
it, I think that has been a pretty easy hurdle to get over, because those BHB ketone monitors are very, very inexpensive. We're all familiar with how to use a handheld
Right.
glucometer, and since it's used the exact same way, it's very easy. It's not like you have to buy another giant piece of lab equipment to have in your
Right.
hospital, right? Um, I think for the folks that maybe are not, um, who just buy the product to have on their shelf and dispense it and, say, here we go, that are not checking ketones appropriately. I mean, there are definitely some places out there that are doing that. And I feel like that's really incredibly
Hmm.
dangerous. Um, that's where these drugs are going to get a bad name, and cats are going to be sick and have problems and all that. And that isn't going to happen very often, but when it does, it can be catastrophic, and you have to be able to have these little handheld ketone meters in your hospital.
And for cats that are, on these SGLT2 drugs that are doing well and have had sort of, initial BHB readings that are in an acceptable range, um, and appear to be well managed, like how often do you recheck their BHB over time?
After the first couple weeks, if they're doing well, then the only time I check a BHB after that is going to be if they're not feeling well.
Okay.
So if you think about when you have a diabetic cat on insulin that is coming in because they're not feeling well and not eating or whatever, the first thing you think of is hypoglycemia, right?
Right.
And so when you have that sick diabetic cat in, you're always checking the blood glucose first and then moving on from there, right? Or ketones. For a cat who is on Bexacat or Cinvalgo, they're never going to be hypoglycemic.
Right.
So you're always going to check a ketone first in those cats. And so you always want to rule out ketoacidosis first and then move on to whatever else they might be sick with. And so I don't necessarily do it on a quarterly basis or every 6 months or whatever else, or even part of their routine lab work for that. It's just not really necessary. But if they're not feeling well, you always want to check it.
So that really is part of how boring diabetes management can be. Really
Oh my
scary.
God. It's so boring. It
I love
really
it.
is so boring. Um, the blood glucose is always normal, so the fructosamine's always normal.
Yeah.
Um, yeah, I mean, they really just become regular cats, and that's nice, and it's a luxury for the owners as well because these cats, have a huge opportunity to go into remission if we can mitigate the factors that made them insulin resistant in the first place. So if we can take care of whatever underlying disease was there that required steroids and, find something else to use for this cat's asthma or skin disease or whatever else, um, then we can take them out of that diabetic danger zone. If we can get them to lose weight and improve, environmental enrichment and make them less bored and do other things that contributed to the obesity in the first place, then we can see if they go into remission without, and we were doing this hopefully with insulin anyway, but now we don't have that risk of finding out they're in remission because they have a hypoglycemic
Right.
crisis.
And by remission in this circumstance, you mean still continuing to take the SGLT2, but having normal clinical signs? Or do you mean not even needing that drug anymore?
Maybe not even needing that drug anymore.
Okay.
So if you can have a client be really aggressive about weight loss and whatever else we need to adjust over 6 months, 9 months, 12 months, and then you discontinue the drug and see what happens because you're not going to have those other markers,
Right.
right? You have to stop the drug and see what happens. And if their blood glucose starts going up, if they, are starting to have clinical signs again, then we know that it's not time. There are cats that are going to need to be on this drug long term, but some of them aren't.
I didn't realize that was an option with this drug as well. I mean, years ago, I feel like all the talk used to be around like starting cats on glargine and hopefully they'll go into remission. And like you said, maybe we'll know because they'll come in hypoglycemic and we'll realize they don't need the insulin anymore. But
Yeah. So the thing with the anything, the glargine or yeah, I mean part of it is just supporting the pancreas, right? So there's something going on with the pancreas that maybe they're not producing enough enough insulin, um, in addition to having all of the insulin resistance throughout the body. So if we could support the pancreas, let it get back to functioning, the beta cells aren't exhausted and they are going back to functioning in a normal way, and we reduce the reason for insulin resistance in the first place, the obesity, the high carb diet, the all of that sort of stuff. That's how, in part at least, the glargine with a diet change was putting these cats into
right,
remission more often than other
right.
things. So we're just doing that in a different way.
Okay.
still supporting the pancreas and hopefully providing a better platform for the insulin to work.
Okay. All right. Well, that's a helpful framework to have to think about it. I did want to touch a little bit on, some of the other drugs that come up in in the guidelines and other talk about feline diabetes regulation, um, other than the SGLT2 drugs. And one that I came across in the guidelines that I had not seen other references to is the U300 glargine,
Right.
an ultra long duration insulin. And my understanding is that it's in the works, or is it
So
available now?
the once a week
Yes, the once a
insulin,
week.
um, it is moving into I can never remember which one is which. The initial trials have been done. I guess is that the pivotal? Anyway, the second round of clinical trials is in the works
For
now.
humans
So that
or for
no,
cats?
no, the once a week insulin for
Okay,
cats
okay.
um, shows a lot of promise. It's very, very cool. My hospital was part of the initial clinical trial, and we had great luck with that for our sample cats, and those were cats that needed insulin. Um, the U300, the Trujeo insulin, the U300 glargine, it is not it's not just 3 times regular Lantus. That's not how it works. What it is it the way the insulin molecule is in that U300, is it allows for a longer acting, more slower release uh, effect in the body. So you're going to have a more smooth blood glucose curve through the day because you've got that insulin being released and absorbed on a more continuous, slower basis. So for cats that are difficult to regulate, even on Lantus, and you're seeing more steep ups and downs with their blood glucose,
Mm-hmm.
sometimes reaching for the Trujeo, the U300 glargine can provide a smoother glycemic state.
Okay. So does that also mean
Okay.
less risk of hypoglycemia compared to other insulins, or not necessarily?
I think it's going to be a lower risk of hypoglycemia just because you are probably not going to be chasing that up and down
Right.
as much. So, if you're constantly looking at a blood glucose curve where it's up and down, and you're adjusting the insulin all the time and maybe increasing the dose to try to mitigate those really high times, you're going to have more of a chance of a hypoglycemic event because of that. So you having that smoother glycemic state is going to reduce the chance of hypoglycemia that way for sure. But yeah, in general, yes, I think you may have a reduced risk of hypoglycemia. I still don't think it's the first insulin that most people are going to reach for, and that's okay.
Okay.
It's not going to be what I reach for first, but for cats that are having a difficult time regulating on regular glargine U100, it's a good next step.
Is it because it's just not the most bioequivalent insulin for a cat, or what insulin do you reach for when you have to use insulin in cats first?
I use glargine,
Oh, the
regular
the U100.
U100
Okay.
glargine.
Okay.
Yeah. Yeah, that's what I typically use. Um, I think that it's between that and PZI that's
Mm-hmm.
going to be our best choice for cats. Even though Vetselin is approved for
Mm-hmm.
cats and works for a lot of cats, it's not going to be as predictably predictably
Hmm.
effective, and have a long enough duration of action for a lot of cats. So you can have a lot of glycemic variation through the day, a lot more with potentially with Vetselin than you would with PZI or Glargine. Um, I think that PZI is great. I just like you 100 syringes. So that's that's my that's my
Right.
silly reason for using it.
No, it makes sense.
It's always just been, yeah, it doesn't really, but that's okay.
Um, a- Another thought that I had, it's been a few years since I was really kind of in the trenches prescribing Glargine, and that was always my preference. And I remember at the time, um, just getting a lot of concerns from clients about the cost of the insulin.
Hmm.
And I assume that that's still a concern with the
I think
prices of
Glargine
drugs
is
in general. Um, and I wanted to
yeah,
check about
Glargine
that.
is very inexpensive now.
Very inexpensive.
It's
Okay. Okay. Well, that's a
yes,
change
yeah,
then.
it's Glargine is very affordable now, which makes it for people who are very cost conscious. I mean, and we're all cost conscious, right? But um, it makes it a hard sell, so to speak, to convince them to use an SGLT2 inhibitor now
Mhm.
in a way, because the Glargine has become much more affordable. And yeah, so there are people that will elect to stay with insulin for some cats, even though they are good candidates for an SGLT2 inhibitor just because of the cost.
Interesting.
Um, I think when we educate people about the safety margin for the SGLT2 inhibitors, it swings that balance the other way a little bit,
Mhm.
because the peace of mind is valuable. Um, and also the lack of having to consider doing curves or fructosamine checks or all this stuff to try to get the cat regulated. You're going to have a cat regulated on an SGLT2 inhibitor within a week, if not sooner. And for insulin, it may take you, weeks or a couple of months before you have a nice, steady regulation for that cat. So, there's pros and cons, but the cost factor, at least for Glargine, is not an issue anymore,
To show.
at least right
Yeah.
now.
Well, I'm glad to hear that because I, hear so many things about um the cost of medications, particularly on the human side, including insulin.
Yeah.
So, I can remember having many discussions about should we use the pen? Should we send it to a pharmacy in Canada? Should we, or
Right.
like clients coming back and saying, my pharmacist told me about this cheaper insulin and it's
Right.
Novolin or
But it wasn't a
not something I really wanted to use.
right.
And
Oh.
um, very hard to very hard to stick with the plan when the client is aware that there's something less expensive out there. So
Yeah, that was a real challenge. The Glargine U300 is still going to be more expensive.
right.
That's definitely not something that has come down a lot. That one is only in a pen.
Hmm.
So that's a challenge too for some people. But um, yeah, having the pharmacist recommend completely different insulins and then having to have that discussion with clients was never fun. But
Yeah, especially when you find out after they've been on the new insulin for a few weeks. Um,
I know, right? Yeah, yeah,
you're like, okay, why is everything out of whack now? I wish I would have known about that. Um,
yeah,
yeah, well, I'm glad that we have other options now, and that Glargine is that price is not as much of a barrier for cases where
yeah,
that's still
for
the best
sure.
choice. Um, and I did want to touch base with you on kind of go off on a little bit of a tangent here because I've really enjoyed this conversation about diabetes, and I'm really excited for the guidelines to come out or for people to be able to really kind of dig into them, and I'm sure there'll be a lot more discussion about them. But you were also involved in, as you said, you are a board certified in veterinary practice for feline medicine. And we were going to spend a few minutes talking about that. And also, you are involved in a very important project with an AHA collaboration between ABVP and the journal here at AHA. So I'd love to hear what you'd like to share about ABVP certification.
Yeah, I love ABVP. So the American Board of Veterinary Practitioners is a specialty board, just like ACVIM and ACVS and all the other discipline specialties. But we are a practitioners board, and so we have 12 different species specialties under our umbrella, and feline's just one of them. But the unique thing about ABVP board certification is that it is not necessarily based in internship and academic or private practice residency. We do have those, but for the most part, this is a private practice process. And so it's approachable, it is attainable for anybody who is providing high quality care to their patients. And um, it's something that you can do while you're practicing with your regular everyday cases. It involves being out of school for a certain amount of time, writing up some cases, doing a credentialing process, and then taking a exam. And so it's a rigorous process, but it is incredibly rewarding and um, is a way to just continue to elevate the care that you provide for your patients and your clients. It kind of like being an AHA person, right? So having a AHA certified hospital shows your patient your patients don't care, I guess, personally, but shows your clients that you are willing to go the extra step and uh, do what you can to be the best veterinarian you can be. And ABVP is very similar. So I feel very strongly uh, about ABVP and trying to get the word out to people because it has done so much for me, allowed me to have these opportunities to write and teach and be a part of guidelines and things like that. And it's opened a lot of doors for me. It's been good for my hospital. It's been good for my patients. And so I would just encourage anybody to look into that. If anybody wants to talk to me personally, reach out to me. I'm happy to do that. So um, you can be board certified in feline medicine, in canine feline combo, avian, reptile, amphibian. We've got sheltered specialty, and then all the large animal things. So it's fun. It's a fun group of people, a lot of very motivated people, and yeah. So check it out. As far as the collaboration that ABVP has embarked upon with AHA, so um, the Journal of the American Animal Hospital Association is now the official publication of the American Board of Veterinary Practitioners. So that is in the works right now. And currently, I'm I'm the ABVP associate editor for that. So we are in the process of getting section editors and different behind the scenes reviewers and things like that for contributing to the journal of AHA. So that's really, really exciting. I think that this is going to be just an enhancement. The journal for AHA has always been geared towards practitioners. So it's a natural extension to have the practitioner specialists be a part of this journal and be able to publish and review and all that. So historically, AHA has used the journal for canine and feline topics predominantly. So now this is going to be able to expand that to all of our different practitioner specialties. So in the future, look forward to seeing articles for shelter medicine, for reptile amphibian, for our large animal species groups. And I think it's going to be really fun. Honestly, it's going to be a process to
Yeah,
get there and to get all of this stuff in place. But what an exciting, cool thing to do. I'm super stoked about getting this underway.
I'm really excited about it too. I'm imagining how um, many different potential contributors this will inspire to either publish something that they're already working on or pursue something that maybe they've been thinking about, so that we can all learn. I mean, every day I'm learning about something new and amazing happening in veterinary medicine that I had no idea was going on. um, and this is such a great way to collaborate and get that information out where others can learn from it. Um, and I think there are also going to be some great options for more of that work to be open access, so it's even more available to as many people who would benefit from it without as many barriers in terms of access and paywalls and that kind of thing too. So um, I'm very excited about that, and
Yeah.
I agree. I couldn't think of a better collaboration because ABVP certified specialists. I mean, you are the specialists out in practice doing the work, and you've gone through this very rigorous training, and you're out there seeing the cases, doing the studies, doing the work, and um, yeah, anything we can do to help that get shared and get out into the world, I think is amazing. And I'm here for all the large animal stuff too. I'd love to.
Yeah, me too. I think it'll be fun. I won't understand half of it, but
Well,
I think it'll be fun to, I think the other important thing as far as the Jaha collaboration is, I mean, obviously it's going to allow for another publication option for people, but there's so much that you can find online now,
right.
that's kind of the Wild West, right?
Hmm.
So Jaha has always been, well, not always, but for a very long time now, a refereed journal. And so when people are looking at the articles that come out, these practitioner focused articles that are coming out, they can know that this is a trusted resource. These are refereed articles. And I think that's important now. I mean, whether we're looking at veterinary things or anything else on the internet, anybody can put anything anywhere,
True.
right? So knowing that we have a resource where things have been vetted, for lack of a better word,
Perfect
I
word.
think is an important point to make.
Yeah, I agree. I'm very excited to see what things look like when the first issues come out.
Yeah, me
So
too.
yeah.
Yeah.
So congrats on your role in that whole process and for helping to bring that to fruition. And thank you.
Thank you. It's been a process.
Yeah.
I was the president of the AAFP a couple of years ago, a few years ago now, and I think that we started talking about it then. And so it's been a process,
Mhm.
but yeah, I'm glad it's finally happening.
Me too. Me too. Well, I'm sure that we could both probably talk about feline medicine and feline diabetes all day long. But but I did want to, as we kind of wrap things up, I did want to ask you. I like to ask everyone, what's one thing that you are excited about in veterinary medicine? Either something that's happening now or something that you're looking forward to in the future. Kind of put you on the
And
spot here.
you should have told me this question
Oh,
before
sorry. I
so I could
usually
think
do.
about.
I usually do.
No, that's okay. I think in veterinary medicine, the one of the most exciting trends that I've seen over the last couple years is that feline medicine has historically taken a backseat to canine medicine in the small animal world.
Yeah.
And as feline practitioners, we have routinely had to use off-label things, and we still do. But for the longest time, we had very, very few things that were approved for use in cats. And now it seems like we have so many more things that are coming out for cats, that research is being done for cats. And so we have, the SGLT2 inhibitors, we have the monoclonal antibody things for
Mhm.
arthritis, we have the FIP drugs, we have all sorts of things that are available now for cats. And it's just been so fun to be able to, um, to see cats with FIP live instead of die, and to see cats that are diabetic be treated, and see our old cats be comfortable. And there are so many things that are still coming down the road for our feline patients. It just seems like cats are having their
Yeah.
day, I mean, and it's about
No.
time. And so it's cool to not be like the redheaded stepchild, of the veterinary world anymore. And um, so I'm excited for cats and their people and cat doctors. And I think it's just going to get better and better.
Yeah, I was thinking as you're saying that, like with it must be exciting for you now, with all of the drugs, as you said, over the years that, like have all these warnings on them for dogs only, not for cat, and all the warnings that we get, like don't use this medication in cats, to now have some medications that are like, don't use them in dogs. This is just for cats.
Yeah, right.
This is
It's like,
our thing.
haha.
I mean, I'm joking, but like you said,
No,
their
it's so
cats can
true
have their
though.
thing.
Yeah. Yeah, it's really cool. And it's about time. It's about time. And it's not just about the cats. Honestly. I mean, it's all of the different things in veterinary medicine that have changed. I mean, when I graduated in the mid 90s, we didn't the whole reception area was full of flea products, right? It was the foams and the powders and the collars and all this, and that's all gone, right? We don't have to think about those things. We have when I back then a 12-year-old cat was old, and now the 12-year-old cat's just getting interesting, right? So it's come so far in just that amount of time. I can only imagine what it's going to be like in another 20 years. It's amazing. It's absolutely amazing.
I love that. I love that. I'm gonna remember that. 12-year-old cat's just getting interesting. Thank you for that.
Well, it's
We're
true.
making diabetes boring and we're making 12-year-old cats interesting. Love it.
Yes. Yeah, you got it.
Awesome.
You got
Well,
it.
any other final thoughts you'd like to share, or any ways for our listeners if they want to follow along with you, or reach out to you, or just stay in touch?
I mean, yeah, you can definitely I mean, I'm not like a social media person, but um if you want to email me, my email is rucinsky.mock, which stands for Mid-Atlantic Cat Hospital at gmail.com. I'm always more excited to talk about somebody else's cases than my own. But especially if you're having questions with how to manage your endocrine cases, diabetes, thyroid, whatever, that's fun, or anything else. Or if you want a job, or if you want to talk about being ABVP board certified, all those things make me happy. So, yeah, reach out anytime. Find me in Maryland.
Awesome. Thank you for being open to having others reach out and connect with you. That's really wonderful.
I mean, that's what we have to do, right? We have to um, help everybody be better.
Amazing. Well, I couldn't think of a better note to end on. So thank you again for all that you're doing for the cats. And
Well,
have a
thanks
great
for
care of
having
your
me.
day.
I love doing this.
Yes.
Yeah.
All right. Well, I'm sure we will talk again soon. Thanks so much.
Awesome. Thank you too.